Hey guys, this is Dr. Shivek. Welcome to my YouTube channel. So guys, this is my second video on the spirometry. So first of all, we are going to discuss the obstructive and the restrictive diseases. So guys, see this diagram. Or in the obstructive diseases, so this is a lung. This is the whole lung, okay? And this whole is the total lung capacity. TLC is total lung capacity, and only this portion is the FVC, forced vital capacity, and the remaining is the residual volume. So guys, now what happened in the obstruction? This is the obstruction here. In the obstructive disease, there is a obstruction outside the lung, okay? And the restrictive, the size of the lung is small. There will be a small lung. So for the difference in the both types of lung diseases, you can learn like this. In the restrictive lung disease, everything is decreased, whether it is residual volume, total lung capacity, FEV1, forced vital capacity, everything is decreased, but the ratio, this ratio is known as Tiffany-Spinelli index. This ratio is normal. So if the ratio is normal, then it is the restrictive lung disease. So, and if the ratio is decreased, then it is the obstructive lung disease. How the ratio is decreased? Because FEV1 is decreased, but FVC is normal here in the obstructive lung disease. So the ratio will be decreased, and this will tell that disease is the obstructive lung disease. So guys, this is very important. In the restrictive, there will be a small lung and everything will be decreased except the ratio. The ratio will be normal in the restrictive lung disease. So you can learn like this. Very important, guys. Now guys, coming to the what are the different examples of these type of diseases. Obstructive, we have asthma, COPD, bronchiectasis, bronchiolitis, and cystic fibrosis. Okay guys, now you can learn this. You can learn the example of the obstructive lung disease by ABC. A for asthma, B for we have two diseases, bronchiectasis and bronchiolitis, and for C we have COPD and cystic fibrosis. So you can learn like this. ABC is the obstructive lung diseases. Coming to the next, guys, what are the different restrictive lung diseases? We have two types of the restrictive lung diseases, intrinsic and the extrinsic. For the intrinsic lung diseases, we have fibrosis and interstitial lung diseases, sarcoidosis, and the occupational lung diseases. So these are the intrinsic. What are the extrinsic? So our extrinsic means outside the lungs. So like chest wall, any chest wall disorder, like any neuromuscular disorder like myasthenia gravis, diaphragmatic injury, and the kyphoscoliosis. These are the examples of extrinsic restrictive type of disorders. So these are the obstructive and restrictive lung disease, guys. Now coming to the next, what is how we should approach this spirometry. So first of all, we have this ratio FEV by FVC. If the ratio is less than 0.7, then it is the obstructive type of disease. Okay, you know that this ratio will be decreased in the obstructive disease, but if it is normal or increased, then it will be the restrictive lung disease. So if it is normal, the patient can have a normal lung or diffusion deficit. Okay, but if it is if the ratio is increased, then it will be the restrictive lung disease. Now we prefer another ratio, that is residual volume upon total lung capacity. This ratio tells us the difference between intrinsic restrictive lung disease and the extrinsic restrictive lung disease. For intrinsic, both residual volume and TLC is decreased, but the ratio will be normal. So it will be the intrinsic restrictive disease. But in the extrinsic, this ratio will be increased. So you can differentiate between these type of restrictive lung diseases. So guys, this was a short lecture, and this is very important, guys. Approach to spirometry is a direct question for your exams. So thank you, guys. This is Dr. Shivek signing off. Bye bye.